Hi, and welcome to the VieSID Press-release. In this video, we report on articles selected from the dental literature published between November and December 2022 that we hope might be of interest to the VieSID community. So let's begin. In the AGODO, we found a paper by Perinetti et al. On a longitudinal study addressing facial growth differences between skeletal class 1 and class 2 untreated subjects. They consider cephalometric data from the Burlington Growth Study retrieved from the online repository Craniofacial Growth Legacy Collection. They selected 13 males and 19 females and compared their facial growth between the age of 9 and 16 years using cephalometric variables. They found out that class 1 and class 2 children differed by 3 variables: condylion to point A, condylion to gnathion, and condylion to gonion, and that the greatest divergence was visible in stage 3 of the third finger middle phalanx maturation, which is reached usually around 12 years of age. The authors concluded that these findings should be taken into account when planning early treatment in children, as in class 2, mandibular deficiency peaks already during puberty. In the archives of oral biology, Dean et al. Explored times of dental crown formation and eruption in humans compared to great apes, including gorillas, chimpanzees, and orangutans. The evolutionary history of living great apes has been independent from that of humans for millions of years. And so the authors wanted to assess how the sequence of tooth formation and eruption in great apes compares to that of humans. They used radiographic films of 159 once free-living subadult great apes and orthopantomographs of 4,091 dental patients aged between 1 and 23 years. Dean et al. Defined stages of tooth development that could be applied to all the 3 great apes taxa for molars, incisors, and canines, and additionally consider 4 stages of tooth eruption. So an eruption, when the crown is within the alveolar bone, alveolar eruption, partial eruption, and full eruption when a tooth reaches the occlusal plane and is in functional occlusion. The outcomes of this study can be summarized as follows. Great ape upper and lower incisor eruption was generally delayed relatively to M2 with respect to humans. Late canine eruption, so close to M3 eruption, is a general human and great ape condition. Active eruption of the canines in great apes, however, occurs over a longer period of time, especially in male gorillas, where it might take 2 to 3 years to reach full eruption, whereas in humans, active eruption may take 8 to 18 months. Relative to the time of active canine eruption, great ape M3 development is advanced and human M3 development is delayed and more variable. In modern humans, as in great apes, time of molar formation and eruption is in fact quite variable, especially for M2 and M3. In some, both incisor and canine formation and eruption are relatively advanced in humans and relatively delayed in great apes. In the archives of oral biology, Wirakun et al. Published a review on the aging of the cornal dentin and the related changes in mechanical properties. With respect to bone, dentin has a limited ability to remodel or repair. And to understand the mechanical properties of dentin, it is necessary to appreciate its collagen and apatite organization. Dentin apatite runs parallel to the long axis of the collagen fibrils. The collagen fibrils orientate perpendicular to the dentin tubules and parallel to the mineralization growth front. The tubules run parallel to the main axis of the tooth from the pulp chamber to the enamel dentin junction, showing an increasing anisotropic pattern. Several factors influence the mechanical properties of the dentin, including the orientation and distribution of peritubular and intertubular dentin, apatite density and distribution, cross-linking between collagen fibrils resulting in a stiffening of the collagen. The authors included 12 studies comparing young to mature human coronal dentin using laboratory tests to test the mechanical properties. In particular, they were interested in the response of the dentin to strain and stress and in its elasticity. Based on the analyzed studies, dentin properties differed between young and mature dentin. In general, young dentin was less mineral dense and exhibited relatively greater overall flexural strength compared with mature dentin. Flexural strength is lower in deep dentin than in more superficial dentin. Age-related changes in inter and peritubular dentin diminish the dentin's dampening behavior and its ability to dissipate energy. Mature dentin demonstrated relatively impaired fracture toughness, increased brittleness, and thus increased risk of fracture. Figure 8 depicts the toughening mechanism of the dentin at the micro and nanoscale in response to strain with reference to denticollagen organization. In Figure B, toughening mechanisms are illustrated at the macroscopic level, showing the response to a fracture extending through dentin. In biomedicine, Kanklerska et al. Published a work investigating plasma concentration of electrolytes in relation to the intensity of sleep praxis. Sleep praxis is associated with variable systolic blood pressure, arterial hypertension, and cardiovascular diseases. The sodium concentration in the plasma influences blood pressure. Thus, the aim of this study was to assess whether plasma sodium concentration was associated with blood pressure during sleep bruxism. For this study, 51 subjects were included. Video polysomnography was used to monitor sleep, and bilateral masseter electromyography was performed. The day after of the polysomnography, the plasma concentration of sodium, calcium, potassium, and magnesium was analyzed, and blood pressure was measured. The sample resulted composed eventually of 8 non-bruxers, 19 mild bruxers, and 24 severe bruxers based on the mean bruxism episode index. Significant differences in plasma sodium levels were found between bruxers and non-bruxers, while the other electrolytes did not show significant differences. The interpretation of these results, I find, is not straightforward, as the plasma sodium concentration might not be the direct cause of increased sleep bruxism activity, but the consequence of a third factor influencing both plasma sodium concentration and sleep bruxism. The author speculated that concentration of diuretic hormones, serotonin level, or vitamin D level could play a role and should be further investigated. In Cranio, Cimino et al. Investigated TMD prevalence in a sample of patients affected by tinnitus. The severity of the tinnitus was evaluated using the Tinnitus Handicap Inventory, which is a self-administered 25-question survey with 3 levels of answers. TMD examination was conducted according to the diagnostic criteria for temporomandibular disorders, Axis 1. Patients were assessed also for oral behavior and neck disability. The patients with a diagnosis of subject tinnitus and referred for TMD consultation were consecutively recruited in 2016 and 2017. They presented tinnitus for at least 6 months, and the episodes of sound perception had to be heard for more than 5 minutes and at least twice a week. To determine whether the tinnitus was a somatosensory tinnitus, the participants were asked to answer the question, is the tinnitus modified by movement of the jaw and/or neck? Eventually, patients included were 37 women and 42 men. Of these, 67% manifested orofacial pain or combined pain and dysfunction and increased extramasticatory activities, but no correlation was found with neck impairment. While interpreting these results, it is important to consider that the tinnitus patients in the study were pre-selected so as to exclude objective tinnitus and tinnitus possibly related to head and neck trauma, ear infections, or other otological diseases that could explain tinnitus. Thus, the sample is not representative of the entire tinnitus patient population. However, I find this high prevalence of TMD indicative of the close relationship between structures of the craniofacial system. The Journal of Dental Research published a commentary by Lobeso et al. On the global need for easy tools for assessment of orofacial pain. In May 2021, the World Health Organization adopted a historic resolution on the urgent need for global oral health improvement, recognizing that oral health is a key indicator of overall health, well-being, and quality of life. The costs associated with oral problems worldwide have been estimated at 545 billion US dollars per year, which is comparable to the economic burden of cardiovascular diseases and diabetes. The WHO Global Oral Health Strategy consists of the following points: include diverse voices and engaged communities, place equity and social justice at the core, tackle major risk factors such as sugar intake, embrace major system reforms, create better data for decision making, close financial gaps. Lobeso and Arab in 2021 suggested to promote interprofessional collaboration between medical doctors and dentists in research, education, prevention, and care provision. However, the authors pointed out that the recent WHO resolution did not consider orofacial pain, if not marginally. The FDI World Dental Federation in 2022 defined oral health as multifaceted and including the ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain, discomfort, and disease of the craniofacial complex. Thus, Lobeso and colleagues stress the fact that attention should be given to temporomandibular disorders that might indeed affect the orofacial complex, causing pain and dysfunction. The taxonomy of TMD has been defined by INFORM, the International Network for Orofacial Pain and Related Disorders methodology, with the latest development consisting in the DCTMD of 2014. As illustrated in the figure, people with orofacial pain in low and middle income countries are less likely to receive care using comprehensive diagnostic tools, such as the DCTMD, because of lack of local language translations and representation in the international knowledge exchange in the field of orofacial pain. Thus, the author stated that the goals of INFORM are to develop assessment tools for TMDs and other orofacial pain conditions that are easy to use, yet reliable and valid, enable global dissemination and implementation, and enhance access by low and middle income countries as well as disadvantaged communities. Here I seize the opportunity to mention that VieSID, the Vienna School of Interdisciplinary Dentistry, shares similar goals and is in fact operating in collaboration with SESUCA, the Superior Council of Central American Universities, for the advancement of research and education in occlusion medicine under a program that we call IDENTICA, or Interdisciplinary Dentistry for Central America. I invite you to check our website under VieSID Research and VieSID News for more information. The Journal of Oral Rehabilitation published a work by Murray et al. On the activity of the pterygoid muscles during speech. The aims of the study were to test three hypotheses, namely that during speech, The medial and lateral pterygoid were both active, but exhibited different patterns of activity, which fluctuated with the vowels and consonants in speech. They considered 3 males and 2 females, all able to read and speak fluently and with a velocity. They used intramuscular electromyography recording to assess the activity of the medial lateral pterygoid muscles and during the pronunciation of nonsense words. These were used to present the desired combination and sequence of vowels and consonants. In particular, they used a combination with a structure of vowel 1, consonant 1, vowel 2, consonant 2, where V1 and V2 are identical, and similarly C1 and C2 were identical, but the first syllable was stressed and the second one was not. The second syllable was the target sound and was therefore analyzed. These words contain both high vowels, which are pronounced with the tongue arched toward the palate, and low vowels, for which the tongue is kept relatively flat and low. So each word was pronounced 10 times with a second pause between one repetition and the other. For both low and high vowels, the lateral pterygoid was most active during the target consonant, and the medial pterygoid was most active during the target vowel. Pronunciation of higher vowels required lower activation of both medial and lateral pterygoid muscles compared to low vowels. In sum, the authors concluded that both the medial pterygoid and the lateral pterygoid were variably active during speech, and their activation is coordinated asynchronously to help achieve complementary speech goals throughout the target syllable. Thus, they speculated that dental interventions might interfere with the speech pattern. We've come to the end of this presentation. I invite you to contact us in case you want to know more about our activities. Otherwise, be ready for next press release. Best wishes to all.